I'll tell you a little bit about Nishant. Welcome. Nuehealth is a San Francisco-based startup, but you've partnered with Nueterra Technologies here, a very well-known and established surgical network in the U.S. and Europe. And you're now allowing patients to be matched with surgeons around the world. So they've got a mechanism to have better and secure communication and direct engagement with providers and collaborators. And Nishant is the director of business development as well as the president of strategy, and has also been a student right here in this town at the London School of Economics. So welcome, Nishant.
Thanks, Indu, and good to be back in London. If I can just see my screen. Great. So at Nuehealth, we believe in improving and enriching the patient-provider relationship, primarily through better exchange of information and better communication between the parties involved. So let's start with an example of, let's say, a patient named Jamie. Jamie has a need for a knee replacement. So one of the first things she can do is come to a consumer-facing site, such as this one, and start to get more information in order to make a decision to get a referral or make an inquiry to a particular provider. And so here we can, let's say, for example, click on the United States. We hope with our partnerships to start expanding into Europe and here in the UK to get more providers on. And here Jamie can click on an arthroplasty for a knee. So one of the things that we see here that she's getting information about is pricing. Package pricing is a very difficult thing in the industry, so if we can do that, the better. We can learn more about our doctor up front, so I can get a quick background of, in this case, Dr. Cravetti in Las Vegas, understand their academic background, and perhaps even watch a quick intro video about that particular doctor. At that point, then Jamie wants to make an inquiry, and so in our world, the Nuehealth world, this is where high touch needs to come in to care coordination. And so this inquiry, when it comes in, now I'm logging in as the Nuehealth care coordinator. When I do that, the first thing I see is Jamie's information, her patient data, and a lot of background contact information, the basic stuff that we might need to know about her. And one of the missing links right now in healthcare coordination is secure communication between all the parties. So we've created this feature called Care Chat. And what Care Chat really enables us to do is have everybody on the patient's care team, which is the doctor, the care coordinator, the other stakeholders involved, be invited to be part of this conversation in a secure HIPAA-compliant way, which is much more relevant for us in the US. And so you can see this care wall here where I can send a public message or a private message directly to Jamie. And now I can log in as Jamie, the patient, and see, similarly, she has her own Care Chat window and ability to exchange information. So again, it's my face, unfortunately, not Jamie's. So when Jamie logs in, she sees, first and foremost, her background of conversation, her care coordinator's prompts. She can send a message directly to any of them and comment in Facebook-like format, but with security here. She can also upload her medical records and have them be viewed by her doctor. So here she can upload her knee x-ray and fill out her medical profile so that the doctor can view it. And in this transaction now, what we're enabling is the doctor to have and the provider to have more information about the patient's medical history so that they can make a decision for approving or denying that patient for being booked for surgery or any medical event. So finally, I want to log into the doctor's side of this entire ecosystem, the provider relationship. And so here's the provider login. So as you can see, the provider now has a complete patient dashboard, which is not just Jamie, but other patients for whom they've been invited to the care team. So here, the provider can see this is Jamie, and she needs a knee replacement. I can view her medical profile. I can view her medical records. And then I can, as the provider, I can either approve or deny Jamie for being booked. At which point now we enable the care coordinator, who's in the middle, to receive that approval, contact Jamie, and book them for the procedure. And post-op, the same tools can be used to allow for rehab communication and better ongoing follow-up throughout. Thank you.
Thank you, Nishant.